start with identifying yourself, your name, the role of your organization that you work in.
My name is Janet Edgecombe. I'm the Director of Nursing here at Stillwater, and Stillwater is one of the homes in the First Atlantic healthcare family.
Beautiful, thank you.
You're welcome.
So tell me a little bit about the clinical flow and how your providers, the nurses, as you represent them, use HealthInfoNet now.
I do use it a lot myself. My nurse managers, we use it to help us build a picture of our patient. When we get a patient from the hospital, we are sometimes missing patient information that we need to really help that patient get to the end result that they want to. For instance, one of the things I use a lot is about immunizations. The immunization history. We have to have that information right from the beginning. We have 3 days to get that information into their record. As you know, if you call the primary care providers of all those different patients, you may take more than 3 days. So we have to have that information in order to offer the vaccine in a timely manner. So we can go into HealthInfoNet, get that information. It's usually right there, right under the immunization tab. Find out when they had it last, and then go and get our consents from the patient. So that is my favorite tab that you have.
That's good to hear. That's good to hear. So having immunizations as part of one of your requirements for admission and making sure your patients are safe, and in particularly during the pandemic, I'm sure, but
Exactly.
Flu, influenza, pneumovax, and things like that, do you find that the information is pretty much available for you?
We do. It's very easy to access. It's usually up to date, and there's so many people that we get to come in, and it's nice to have a one-stop shop, which is what is fabulous. Trying to call every single primary care provider and ask those questions, then they'll send you the medical records, and then they send you to a different secretary for that provider if you have a certain hub. So to have one stop and you can get them all at once, it's fabulous.
That's great to hear. We appreciate that, and we'll continue to work on getting more immunizations as time goes on. So that's good to hear. So other than the immunization, can you tell me some other data that you might find important, or is there other things that you look at within the clinical portal? Let's say, for instance, if you have a patient who is a referral, do you need to look up data to see what their past history is, or their hospitalization treatment plan to help you plan for their care once they get to Stillwater?
Yes, absolutely. And a lot of times our social worker will then access HealthInfoNet. So it's not just nursing, but social work as well. And also, we not only to plan for them to come in, but also to help plan for how their discharge will be. What was their home like prior to going to the hospital? And so we use it as helping us plan for the continuum of their care. So we can look at what were they doing at home, what was their life like before they went to the ER, before they got admitted to your hospitals, and how can we plan for their safe discharge home? And a lot of that information is available right in HealthInfoNet. Prior loss function, it's great.
I love to hear this, because this is exactly why it's such a wonderful tool. And again, like I said, we're concentrating on long-term care right now because your needs are different than an acute care setting or perhaps an internal medicine center. So this is so good. It is great to hear what you're sharing with us. So let me just look at my questions here to make sure I get everything that I want to ask you. Can you perhaps share with me, without breaching any confidentiality, obviously, of a situation that was very helpful that, and you may not, I'm putting you on the spot, I'm afraid, but if you could, have you got an example of how it might have helped a particular situation for you?
There, there are situations when it's been very helpful. We, as long-term care providers, have many regulations, as I'm sure you know.
Mhm.
One of them is to report if there's been a fracture. Well,
Uh-huh.
we often will have someone will fall. We don't know right away if they've had a fracture. So for us to be able to access that information timely is very helpful for us to maintain our compliance to those regulations. So what we can do is if we've sent someone to the emergency room, we can then go in and access the emergency room record and determine that yes or no, there's been a fracture. And then we can do what we need to do to maintain compliance. We are then able to say to our staff, you know, what's happened to that client too. And also it helps us know the patients where they need to be. We
Mhm.
made the decision and that we can maintain compliance on our regulatory end. So it's extremely helpful then.
Perfect example. So important. And, HealthInfoNet is used a lot in those type of quality metric reporting that needs to be done. And this is timely and easy to provide. So excellent example. Thank you. So again, I'm done with the interview conversation. Do you have any questions for me?
I don't, and I so appreciate this service. It's been great for us, and we'll continue to use it, and I appreciate you reaching out, and I think I'd hang out with you anytime.
I love it. Thank you so much. We really appreciate it. And again, so much appreciate what you're doing in these long-term care facilities, particularly during this pandemic, and for all the healthcare providers taking care of our patients. So again, thank you very, very much for your time.
Well, thank you very much.